It is important for anyone who may be at risk for HIV to get tested regularly, and for those who are diagnosed with HIV to seek treatment as soon as possible. With advancements in antiretroviral therapy, people living with HIV can live long and healthy lives, and the risk of transmitting the virus to others can be greatly reduced. In addition to medication, it is also important for individuals with HIV to maintain a healthy lifestyle, including getting regular exercise, eating a balanced diet, and avoiding behaviors that can weaken the immune system, such as smoking and excessive alcohol consumption. Preventing the spread of HIV is also crucial, and can be achieved through methods such as practicing safe sex, using clean needles for drug use, and getting tested and treated for other sexually transmitted infections. Education and awareness about HIV, as well as reducing stigma and discrimination towards those living with HIV, are also essential in combating the spread of the virus. It is important for individuals, communities, and governments to work together to support and advocate for policies and resources that promote access to HIV testing, treatment, and prevention. By working together, we can strive towards a future without HIV. In addition to ART, there are other strategies to manage HIV, such as PrEP and PEP for prevention, and regular monitoring of viral load and CD4 cell count. It is also important for individuals living with HIV to maintain a healthy lifestyle, including eating a balanced diet, exercising regularly, and avoiding drugs and excessive alcohol. Support from healthcare providers, counselors, and support groups can also play a crucial role in managing HIV, as they can provide information, emotional support, and help individuals navigate the challenges of living with the virus. It is important for individuals living with HIV to stay informed about their condition and to take an active role in managing their health. Overall, HIV is a manageable condition with proper medical care and support. By staying informed, seeking early diagnosis and treatment, and adhering to medical advice, individuals living with HIV can lead healthy and fulfilling lives. It is also important for everyone to educate themselves about HIV, practice safe sex, and get tested regularly to prevent the spread of the virus. Yes, there can be side effects associated with antiretroviral therapy, ART, medications used to treat HIV. It's important to keep in mind that not everyone will experience side effects, and the effects can vary depending on the specific medications being used. Some common side effects of ART medications may include 1. Nausea and vomiting. 2. Diarrhea. 3. Fatigue. 4. Headache. 5. Rash. 6. Insomnia. 7. Changes in body fat distribution, lipodystrophy. 8. Elevated cholesterol levels. It's important to communicate with your healthcare provider about any side effects you may be experiencing while taking ART medications. Your healthcare provider may be able to adjust your treatment regimen or provide additional support to manage side effects. In some cases, side effects may improve over time as your body adjusts to the medications. It's also important to take your medications as prescribed and not skip doses, as this can reduce the effectiveness of the treatment and increase the risk of developing drug resistance. If you have concerns about ART medications or are experiencing troubling side effects, be sure to discuss them with your healthcare provider. Antiretroviral therapy, ART, is the standard treatment for HIV and involves the use of a combination of medications to suppress the replication of the HIV virus in the body. There are several classes of antiretroviral drugs that work in different ways to target the virus and prevent it from multiplying. Some common classes of ART medications used to treat HIV include 1. Nucleoside or nucleotide reverse transcriptase inhibitors, NRTIs. These drugs block the reverse transcriptase enzyme, which is essential for HIV replication. Examples include tenofovir, emtricitabine, and abacavir. 2. Non-nucleoside reverse transcriptase inhibitors, NNRTIs. These drugs also target the reverse transcriptase enzyme but do so in a different way than NRTIs. Examples include efavirenz, nevirapine, and rilpivirine. 3. Protease inhibitors, PIs. PIs interfere with the protease enzyme, which is needed for the final processing of HIV proteins. Examples include ritonavir, atazanavir, and darunavir. 4. Integrase inhibitors. These drugs block the integrase enzyme, preventing the integration of viral DNA into the host cell's DNA. Examples include raltegravir, dolutegravir, and elvitegravir. 5. Entry inhibitors. These drugs block the entry of HIV into the host cell. Examples include maraviroc and enfuvirtide. 6. Pharmacokinetic enhancers. These drugs, such as ritonavir or cobicistat, are used in combination with other medications to increase their effectiveness by slowing their breakdown in the body. The specific combination of medications used in ART will depend on factors such as the individual's viral load, CD4 cell count, potential drug interactions, and any existing drug resistance. It's important for individuals with HIV to work closely with their healthcare provider to develop a treatment.
Antiretroviral therapy, ART, is the recommended treatment for HIV. ART involves taking a combination of medications that work to suppress the virus and prevent it from replicating in the body. With a proper adherence to ART, the virus can be controlled to undetectable levels in the blood, leading to improved overall health and a reduced risk of transmission to others. Common symptoms of HIV infection can include fever, fatigue, swollen lymph nodes, and rash. However, it is important to note that many people with HIV may not experience any symptoms at all, especially in the early stages of the infection. This is why regular testing and early diagnosis are crucial in managing HIV. In summary, HIV is a serious virus that attacks the immune system and, if left untreated, can progress to AIDS. However, with access to proper medical care and treatment, people with HIV can live long and healthy lives. It is important to know the symptoms of HIV and to get tested regularly, and to always practice safe sex and avoid sharing needles to reduce the risk of transmission. That's all for today's video. I hope you found it informative and helpful. If you have any questions or would like to share your own experiences with HIV, please feel free to leave a comment below. Don't forget to like, share, and subscribe for more content on health and wellness. Thanks for watching and see you next time.